Honorable Minister of State for Health, General Duties, Honorable Anifa Bangirana Kawoya, the Permanent Secretary represented by Dr. Olaro, the DG represented by Dr. Moruta. I want to appreciate every ministry because of the time, every department, every agency that are represented. I want to appreciate our partners, the Japanese International Cooperation Agency, JICA. I want to particularly appreciate the NDA for pushing pharmacovigilance, very, very important in addressing issues of patient safety that starts, like the Honorable Minister said, with the healthcare provider. Members of the media confraternity, thank you for always being here. In fact, the whole of today is about you and taking it forward. Ladies and gentlemen, on behalf of the WHO representative in Uganda, Dr. Jonas Tegen Wodi Miriam, who is away out of the country, unavoidably could have been here. But I want to welcome you to this World Patient Day 2022 commemoration. This is one of the very important days in my 6 years of being in Uganda that has been commemorated so effectively by the Ministry of Health and partners. If you will recall, thank you. If you will recall, about 2 years ago, even during the COVID, the theme was around the safety of healthcare providers. Like the Honorable Minister said, so that we can appreciate that the safety of the patient starts with the healthcare provider. I want to register that every year, millions of patients suffer injuries due to or die because of unsafe and poor quality health care. And note the figures that have been given, but I'm going to consolidate on that. Many medical practices and risks associated with health care emerges as major challenges for patient safety and contribute significantly to the burden of harm that is done to our patients. The most detrimental errors are related to the diagnosis. Like Chen said, the testimonial, it started from the diagnosis. Calling a particular medical ailment a name that is not well known, using a pharmacological or clinical name rather than call it the way it is. And that became a problem for that particular patient. May also or is so rest in perfect peace. It is estimated, even in high-income countries, that 1 in every 10 patients, and it's as that high, 10%, is harmed while receiving care. You can imagine how much more that will translate to in developing countries. Each year, and these statistics have been given, 134 million adverse reactions occur in hospitals in low and middle-income countries due to unsafe care, resulting in about 2.6 million. Colleagues have talked about 3 million. Yeah, close to it. This harm can be caused by a range of adverse events. An adverse event does not mean it has to be the type we had with the Septrin, sorry to use that name, sulfadoxine pyrimethamine, which is called Stevens-Johnson syndrome. It's so severe that every orifice of the body begins to bleed. And I wouldn't imagine what agony that patient will have gone through before she passed on. But we have a responsibility to prevent the next one. And like we said, nearly 50% of them are preventable. Preventable by you and I, including the media, who will from today till another World Patient Day, we drum this message across. Harm can also be caused by unsafe medicines. WHO recognizes that substandard and falsified medical products are a constant, pervasive, and unacceptable public health threat. And you can take it as close as possible to COVID-19 pandemic or Ebola virus. Like we said, are a constant, pervasive, and unacceptable public health threat. They harm patients, damage trust, and you needed to listen to the Honorable Minister when she talked about integrity of the health system as we move around. It wastes precious resources, which is not there in many low and middle income countries, and contributes also to the resistance against antimicrobial management. In 2017, WHO estimated that more than 1 in 10 medicines in low and middle income countries is substandard or falsified. 1 in 10. Each year, these countries, and I mean the low and middle income countries, spend an estimated $30 billion on unsafe and falsified medical products, not including the full range of socioeconomic sequelae, the complications that follow. Unsafe medication practices and medication errors are a leading cause of injury and avoidable harm in healthcare systems around the world. Globally, costs associated with medication errors has been put at about $42 million American dollars annually. Errors can occur at various stages of the medication use process. Medication errors occur when weak medical and the health system and human factors such as fatigue, stress, like we had during the COVID-19, could lead to even staff shortages. And I want to appreciate that the chair of the Continuity of Essential Services, Dr. Olaro, Director of Clinical Services, is here. We had to battle with a lot of healthcare infections during the COVID-19, which was very disturbing. When patient is sick, you can imagine what happens to tens of patients he would have or she would have attended to that day. So fatigue, stress, staff shortages affect prescribing. And remember we said from diagnosis, transcribing, dispensing, the administration and monitoring practices. A mapping issue of monitoring was raised. And this can cause severe harm and even death. The Honorable Minister, distinguished guest, multiple interventions to address the frequency and impact of medication errors, including the substandard and falsified medications, have already been deployed or developed and have been deployed even in our country here. Yet their implementation varies. A wide mobilization of stakeholders supporting sustained action is very necessary. Recognizing that patient safety is a global health priority, the World Health Assembly adopted a resolution 72.6 on patient safety, which was endorsed. This endorsed the establishment of World Patient Safety Day to be observed annually by member states. Again, I want us to appreciate Uganda because you have taken World Patient Safety Day very seriously. Please, can you give a round of applause? This is commemorated on 17th of September, which falls on a Saturday. But we appreciate the proactive effort of the government to have put it on a day like this. The theme for this year's day is medication safety, like has been mentioned. This is aimed at consolidating efforts of the ongoing global patient safety challenge, which has been well articulated in the action plan, the strategy and the action plan that was launched, Medication Without Harm, in March 2017. The slogan for this year's celebration is Medication Without Harm. It further draws attention to the importance of establishing safer medication system, and I mean the word system, from all the way to the highest health facility, Molago, to the community, the mouth of the patient. This is what we refer to as the system. And that also includes all our procurement and supply chain all the way down. It is important that we focus on every step of the way. This is the only way we can achieve our goal of keeping our patients and even health workers safe. The global campaign has a wide range of activities, Honorable Minister, and it's for all key stakeholders, including the development of national campaigns, organization of policy forum, and I appreciate the webinar that took place. Many partners were there, including WHO under the leadership of the ministry, advocacy and technical events, such as the one we are having, capacity building initiatives, and as in previous years, lighting up some iconic monuments, landmarks, and public places in orange, the signature mark of this campaign. And we want to appreciate JICA for giving us this beautiful jacket. Mine was smaller, that's why I couldn't put it on. The global campaign's call to action is know, check, and ask if you are in doubt. It aims to encourage and empower patients and their caregivers, as well as healthcare professionals, the nurses, the physicians, the pharmacists, and all others, even community health workers, our VHTs, community-oriented resource persons in health, to take a more active role in ensuring safer medication practices and medication use processes. As WHO in the African region advances efforts towards universal health coverage and the achievement of the Sustainable Development Goals, patient safety will be prioritized through the following considerations and interventions. One, the first one is called RAISE. That's the first intervention. Raise awareness of high burden of medication-related harm due to medication errors and unsafe practices, and advocate for urgent action to improve medication. This is why I said it is more or less centered around media and anyone that has to do with information dissemination. Number two is to engage key stakeholders and partners, such as several that have been mentioned, including chain. It's important that we empower, engage them so that they can prevent, and I appreciate the Honorable Minister already inviting the chain, the community action group, to move to other districts. We will discuss with you as time goes on through Dr. Martin on how we partners can support the government to move them, particularly under the PDM. The opportunity in the parish development model cannot be overemphasized. And this is under social protection, Pillar 4. If you can enter through that, I think we will get a very serious engagement and mileage. Number 3, we need to empower patients and families to be actively involved in the safe use of their medication. You don't have to keep drug and say, because I know child B, after child A, then I can keep some for child B when it develops a particular illness. No. And they are not stupid. The community people are not stupid. We all came from there. When you give them information, they are empowered. This is what we are talking about. Scale-up intervention of WHO Patient Safety Challenge, Medication Without Harm. And Uganda has gone ahead through chain to have listed those things where my friend in green is adjusting his equipment. The last one, which is not the least, is to promote implementation of research to guide decision-making and adoption of better behavior related medication safety. Without information and evidence, and Uganda is well noted for that, and NDA, we need to see how we get more and more of that through the entire process, generate evidence. And I request JICA to also spare up some resources in that area, so that we can have information that will guide the Honorable Minister to do policies that are related to keeping us and the patients safe. On the World Patient Safety Day today, I urge all stakeholders to fully commit to implementing the WHO Global Patient Safety Challenge, medication without harm, and to accelerate the actions necessary to ensure safe medication processes. The need for adequate and accurate data and information to guide future decision-making and optimization of therapeutics for good treatment outcomes in the region cannot be overemphasized. I'm also in Uganda. I would like to end by congratulating the Ministry of Health and the partners for heeding to this campaign and observing this day, not just for this day, every day of the year, like I said, till the next year and even years thereafter. Thank you for listening. Happy and result-oriented commemoration. To God and my country.
Thank you so much, the WHO, for that message. Thank